Palliative care actually is the branch of medical care that deal with improving the quality of life of patients who have a life-threatening illness, example, advanced cancer. Often there's a common misconception that palliative care deals with only terminal care, meaning the medical care at last days of life, which is true. Part of our scope actually is to help to provide comfort care in the last day of life, but actually palliative care can be involved much earlier on in their cancer. When someone is still going through treatment for the cancer, and if the cancer pain is difficult to control, we can ask by the oncologist to come in to help in the cancer pain management. Because when the cancer pain are better managed, they will also have better quality of life. We realize that actually in most of the established centers in the world, they will have a palliative care services or Department of Palliative Medicines as part of their comprehensive cancer care management for their patients. We are probably the first medical center in the private sector to have a proper palliative care services to provide the palliative care to our patients who are being treated in public cancer center. A normal day for me usually begin in my hospital rounds. I covers 2 hospitals in Mount Elizabeth Hospital as well as clinical hospitals. After my round in the hospitals, I will have my clinic sessions. I see my patients in outpatients, and after that, usually I will do home visits. The home visits are actually for our patients who are too weak to come to our clinic. The vision of public cancer center when they set up these palliative care services is to want to continue to care for our patients even they are not able to come to our clinic anymore. At the end of the day, if you realize that actually if they are symptom-free and they have little suffering, I find more joy seeing that happens. And I'm also very encouraged by a lot of the family members who come back to thank us, who show their appreciation for our care for their loved ones in the last day or month of their life. I find this job is very meaningful to me. Because we deal with a lot of patients who are dying or condition getting worse and worse, many of my colleagues would think that I'll be a very sad person because I always see these things in part of my life. But if we look at it that we are there to help our patient or family members to find bearings in the so seemingly hopeless or desperate situations, and to able to get their symptoms under control, that they're able to do the things that they want to do. We find a lot of joy in helping them to achieve what they can do in that period of times.